The next person I'd like to invite to say a few words is Ms Geraldine Fitzpatrick, and Geraldine is the Principal Officer in the Department of Health who's responsible for services for older people.
And first of all, I suppose I would like to say, yeah, the department did commission, I suppose, is the word, this piece of research from Trinity, and thanks very much to Trinity and particularly Atlantic Philanthropies, who have very generously facilitated it. We were very anxious, and it has been a commitment of the previous government and this government to get to grips with a dementia strategy for the last few years. But contrary to the way a lot of things are done, we thought it would be useful to try and compile the evidence before we started on the strategy this time, not to be halfway through the strategy and then decide we don't have the evidence. So it is very timely that we have this evidence base to work on at this stage. I suppose what I was looking for to give you is a sense of the context now that we have to develop the strategy, and I suppose a niche that nobody else has spoken about today. And the first context really is the government commitment in relation to the strategy. And as you can see, and the Minister has already referenced it, it is a specific commitment in the current programme for government to develop a national Alzheimer's and other dementia strategy. And really, I think we can get a flavour of where the strategy is going to go from actually the commitment itself, which specifically references increased awareness, early diagnosis, and the development of enhanced community services. And if we looked for nothing else and got nothing else out of a dementia strategy, I think it's certainly the signal of the way to go. It's to be developed on the basis of the best evidence available from national and international sources, which we now have, thanks to everybody involved. And it will also support the delivery of long-term care services, and it acknowledges the future demographic trends. However, that is only one part, unfortunately, of the reform process that the department and the country is now embarking on, because I think we are now facing into one of the most radical reform periods in the history of the state since the state was actually founded, in that we are now looking at a radical change in the way the department and this government both funds and structures the delivery of health services. It's enshrined in two new principles that underpin the whole thing, which is basically there will be a purchaser kind of provider split, and it will also be enshrined in a money follows the patient principle. And really, they're all underpinned by the issues of need that health services and when I say health services actually here, I'm also including personal social services, because we do actually in this country combine the two together in one ministry and intend to do so. So basically that there would be an allocation based on need, but also ability to pay. So those are the principles that the new structures are going to be based on. And in order to get there, what we're already embarking on and supposed to be for the end of this year is an interim structure for the HSE. And basically, and it was announced just before Christmas, that the new structures are going to envisage 7 directors with their own budgets. Now, for those of you who don't kind of maybe see that this is directly relevant, actually, I don't know how many calls I'm fielding at the moment from people to say, where is palliative care in this? Where is dementia in this? Where is whatever it is I'm doing in this? And actually, I think where we have to get to is where is the patient in this? And the issue is the patient is everywhere in this. And the issues that we need to start to look at are really, if money is following the patient, how are we going to navigate our way through both this interim structure and the final structure that we will end up with, which is really towards a universal health insurance model and also towards maybe a separate social insurance model. The commitments for this year, and things will become clearer towards the end of this year, is that there will be a white paper on universal health insurance. And there will also be progress on setting up a primary care fund. At this stage, it's not quite clear if both hospitals and primary care will be covered by a universal health insurance model, or if the universal health insurance model will apply only to hospitals, that primary care will be more in a social insurance fund, and that social care, what we call social care, will continue to be primarily taxation-based, which it is at the moment. So I just wanted you to understand the complexity of the changing environment that we now have to develop this dementia strategy in. And I suppose we need, and it is an opportunity actually at the moment, because at least it's not already done and we don't have to go back and visit it. So we can actually use the evolving structures to actually shape the dementia policy and make sure that there is a fit for the dementia policy in whatever way the structure ends up. So the policy, as we're developing it, and the strategy will have to align with these changing structures and these changing funding models. And really, I see one of the key things that will help eventually a patient and their family sort of navigate their way through both the interim and the changing structures is some kind of single assessment tool. It's something, and Noel will probably be talking to you more about it, it's something the HSE is working on at the moment. But we need both the systems to underpin the new structure, and people were talking earlier about the need for more information and accurate information. So we need those systems, and we need a proper assessment tool that will, as I say, go with the person, whether they're navigating their way through acute, through primary, or through the social care elements, so that all of the services they need can be at least worked through in a rational way. The other thing that's not on the slide, and which I think we also need to bear in mind, is that the Department of Justice is also working on new mental capacity legislation, and I think that is going to be vital to any kind of future dementia strategy as well, because the legal status of people who have capacity issues, particularly in this country which has a very strong constitutional protection for things like property and personal rights. So the clarity that we need to bring, because I think we're still operating off the old Lunacy Act, so I think the clarity we need to bring to capacity issues and mental capacity will also form another huge element of that. So in summary then, we hope to set up, well, we will set up the working group this year. The commitment is for 2013, so that's my aim, to have a strategy next year. The working group will be decided by the Minister, terms of reference and a timeline, and all of that will be published as soon as he decides this year. And that's very briefly the context. Thank you.